Hello students, welcome to Angel Health Academy. Topic for the day or topic for the session is maintenance of records and reports. Maintenance of medical and healthcare records and reports. Maintenance of health records or medical records and reports is crucial or important for ensuring or making accurate patient care and adequate patient care and legal compliance. So in connection with the legal problems, okay, or to cope up with the legal problems and for operational efficiency, for the efficient functions and of the healthcare agency. So maintenance of health records and reports is very crucial or very important for one is to make sure or ensuring the accurate patient care, that is complete comprehensive patient care according to his needs and according to his problem. Second one is to compliance the legal aspects, okay, to overcome or to solve the future legal problems or issues related to patient care, okay. And last one is for the operational efficiency of the organization, for the effective functioning of the organization, because this information can be shared between the departments of the hospital, and hospital healthcare team will come to know that all the information and data related to the patient problem and needs. Thus, they can render a comprehensive, effective patient care and effective functioning or operational functioning of the hospital. The key components or components involved in the maintenance of records and reports or medical healthcare records and reports are: one is accuracy and completeness, that is maintenance of accuracy and completeness of the record and reports. Second one is maintaining the time, okay, timing, that is timeliness. Third one is data privacy and security, okay, making privacy confidential and securing the information of the patient healthcare details, okay, data privacy and security. Then fourth one is maintaining standardization, quality in recording system, maintaining standardization. Fifth one is regular audits and updates, so regularly or periodically checking, inspecting the medical records and the healthcare records and updating the recording software or recording system, okay. Then sixth one is accessibility for all the healthcare team members, okay, maintaining the or making sure of the accessibility and availability of the records to all the healthcare team members who involved in that particular patient care service. Then seventh one is backup and disaster recovery. So periodically record has to be done backup, okay, and recover the all the information or data if anything is happened, okay, that is a disaster recovery. So backup and disaster recovery. Then eighth one is compliance with the legal and regulatory standards. So of course there would be a chances of legal problem and issues. So we have to adhere to the legal and regulatory standards, that is national and international medical health care records standards has to be maintained, okay. So that is compliance with the legal and regulatory standards. Then ninth one is retention policies, how long a record or records has to be maintained in the healthcare institution. That is based on the act or based on the policy, based on the law or based on the hospital or institutional policies, okay. The last one is 10th one is training and education of the healthcare team members, how to effectively handle the records, that is training and education. Let us discuss in detail about this 10 points under key components of maintenance of medical and healthcare records and reports. First one is accuracy and completeness. It includes accurate data entry, okay, all the data of the patient or related to patient care has to be recorded accurately or correctly, okay, ensuring all patient information, diagnosis, treatment plans and the outcomes, the result, all are entered correctly in the patient case sheet, okay, or patient medical record. So that is accurate data entry. Second one is completeness. Record must be include a detailed notes, short and precise and detailed notes of the or about the patient's visit in the hospital, okay, or OP, and the type of the medications and dose of the medication patient is taking during the hospitalization, and all the lab test results of the patient, and even care plans and what are the care rendered to the patient, what are the treatment rendered to the patient, all must be written precisely, briefly, with complete and accurate information. That is called the completeness of the record. So accuracy and completeness include accurate data entry of patient information, and complete information of the patient has to be recorded in the medical or healthcare record. The second component is timeliness, maintaining the time. Healthcare record should be updated promptly after each patient interactions. So whenever the patient gets rounds, or whenever the nurse give the treatment, or any other hospital related procedure, invasive or non-invasive procedure has been done, immediately it has to be recorded clearly, okay, without losing the time, okay. That prevents the forgetfulness about the patient care. So healthcare record should be updated or recorded promptly after each patient interaction or communication or patient care. Delays can lead to error in the treatment, okay, or it also can lead to oversight, repetition of the same procedure, okay, or sometimes there is a chance of repetition of the same treatment, okay. Thus record has to be maintained, okay, immediately after the particular procedure, okay. That is regarding timeliness. The third component is data privacy and security. It includes HIPAA. Okay, HIPAA is nothing but, HIPAA is an act that protects the privacy and the security of the patient record or medical records in the healthcare settings. Thus, healthcare providers must comply or follow with the data privacy laws. Okay, so it is a law. Okay, HIPAA is a law or the act to maintain the data privacy or information privacy or making confidential of the patient data, like HIPAA is a Health Insurance Portability and Accountability Act, which control the proper security of the handling of the patient information. Okay, the information has to be passed only to the healthcare team members when it is really necessary. Okay, otherwise it has to be kept in privacy or confidential according to HIPAA. So HIPAA given the control the security of the patient information or handling patient information by the healthcare team members. The second component under data privacy and security is data encryption. Okay, that is nothing but to protect against the unauthorized access of the patient information or data, and sensitive information, delicate information of the patient must be encrypted and stored securely, that couldn't avail, or no person can go inside and collect that patient sensitive and unauthorized data. Thus data encryption is nothing but that is the protection of the data of the patient or medical and healthcare information of the patient against the unauthorized person or the team. Okay, only the medical team member should avail, okay, who involve the patient care and the treatment. Okay, otherwise it has to be or it must be encrypted and stored securely. Okay, that is about the data privacy and security. The fourth key component is the standardization. It includes uniform documentation practice. Uniform means everywhere in healthcare settings we are following a uniformity, that is uniform documentation practices. So following standardized format in recording such as ICD codes, that is International Classification of Diseases for Diagnosis. So whenever we record the diagnosis in a medical record or healthcare record, we have to follow ICD codes, that is coding must be done according to ICD codes, that is International Classification of Diseases. And at the same time, whenever we record the procedures, various nursing procedures and other medical procedures, we have to follow the CPT codes, that is current procedural terminology codes. So whenever we coding in patient medical health record or patient healthcare records, we have to use ICD codes and CPT codes for diagnosis and for nursing care procedures respectively. This ensures the consistency. Okay, the standard or quality, then it make more easier to collect the data or data retrieval. Data retrieval is nothing but the access of data, okay, availability, making availability of the data from the system or from the source, okay. So that is about the uniform documentation practices. That is coding with the ICD codes for diagnosis and coding with the CPT codes for any procedures. Then under standardization, second point is use of electronic health records, that is EHRs, that is electronic health records. So most healthcare system at present or nowadays utilize the electronic healthcare records. You can see the picture of electronic healthcare record, which facilitate efficient record maintenance and sharing and updating. So it is easy for maintaining effectively the medical health record or medical information of the or healthcare information of the patient, and it helps to share with the other healthcare team members so easily, and it can easily update, okay, as it is an electronic health records. That is maximum utilization of the EHR, that is electronic health records, which facilitate the effective maintenance, effective sharing and effective updating of the medical healthcare record or digital healthcare record of the patient. That is about the component of standardization. The fifth component is regular audits and regular updates. Regular audits and regular updates. First one is regarding audit. Routine checks of the medical record or health record ensure that or make sure that records are accurate, correct and complete and up to date. So routine checking of the medical health records or patient healthcare records, okay, sheet ensure that records are accurate, okay, correct, records are complete and records are up to date, okay. Any inconsistencies, okay, any changes can be easily rectified, okay, can be find out during this process of routine checking up of the health record of the patient or medical records of the patient. That comes under audits. Audits is nothing but periodical or routine checkup, routine checks or checking up of the medical and the healthcare record of the patient. Second one is if it is used any software, that is software updates. In electronic health record we use software, so periodical software updates. Healthcare information system, HIS, okay, I have been already uploaded a video about HIS, healthcare information system or management information system. You can go through that if you would like to know more about healthcare information system. So healthcare information system must be regularly updated, okay, that is connecting the patient record through computer system, that is called the health information system, okay. So HIS or health information system must be regularly updated, okay, periodically or regularly or routinely updated for the security patches and new functionalities of the healthcare information system, okay, to secure the healthcare record or patient medical record and to get the new functionalities and to get the current new functions of the that software, okay. So whenever we update the software, we'll get the new functionalities, okay, new functions, the new functions of the software, okay, that can be easily used for the effective maintenance of the medical and the health record of the patient. So that comes under regular audit and updates. Then sixth component is accessibility. It includes role-based access and availability. First one is role-based access. So only authorized personnel is nothing but healthcare person, healthcare staff, health team members, okay. Only authorized personnel should have the access, availability, okay, to specific parts of the healthcare records or medical records, okay. So according to his designation, according to his position, he has to access only that part of the health record of the patient, okay. Other people may not access that part. That is called a role-based access. According to the role of the health team member, he has to avail or he has to access or he has to get that specific part of the patient healthcare records. Second one is availability. That is nothing but record should be easily accessible or available to authorized healthcare team members or authorized health professionals to ensure the continuity of the care. So health care of the patient or medical care of the patient has been done by a group of different health team members. To maintain the continuity of the healthcare, all the healthcare members or authorized healthcare personnel should avail or should easily accessible the patient healthcare record or medical record. Okay, this is comes under accessibility, that is role based access and general availability or accessibility for all authorized health team members or healthcare professionals. Now, seventh one is backup and disaster recovery. That is recovery of the patient health information or health data and backup. Okay, storing of the patient health care or medical care details. So, regular data backs are crucial to prevent the data loss. Though it is an electronic media, sometimes there is a chance of data loss due to virus attack or due to any other electronic related problems or issues. That includes the system failure, okay, hard disk failure or system failure or any natural disasters with lightning, thunder, etc. Okay, thus regular data backups are very crucial, very important to prevent the data loss. So periodically the data of the health record or medical record of the patient, the data has to be collected and stored in a separate file for a safe custody to prevent the data loss. Thus, a well-structured disaster recovery plan should be in place or should be available. Okay, so if it is any system failure or any natural disasters, we have to able to recover that data of the patient. For that, we need a well-structured, well-planned disaster recovery plan should be in place to avail or access the patient health records or medical records. This is about the backup and disaster recovery. The next component is the compliance with the legal and regulatory standards. To maintain the health record or medical record, the health personnel has to follow the legal laws, okay, or act or regulatory standards that is set by the national or international regulatory boards that has to be followed, or policy of the institution has to be followed. Okay, so all healthcare records must be adhered or according to the national and international regulation which govern, which control the medical data. So to control the medical data and healthcare data, we have both the national and international regulation or regulating bodies. Okay, their regulation standards has to be followed, has to be maintained in recording the data of the patient. Okay, in some cases record need to be maintained for a certain number of years if there is any legal issues, okay, or for legal purpose. In such a case, we have to maintain that record with a certain hospital policy or the regulatory standard policy or the law and act in relation to medical and healthcare records. So whenever it is needed, we have to maintain the case sheet or medical records of the patient for years or more than years according to the legal purpose or according to the legal issues related to that patient healthcare and other healthcare related problems. That is about the compliance with the legal and regulatory standards. Ninth one is retention policies. As we have already discussed, sometimes patient health record or medical record has to be retained for a long period if there is any legal issues or anything like that. Okay, so that comes under retention period. So healthcare institutions should follow the guidelines for how long to retain health records or medical records of the patient. Okay, it depends upon the law, it depends upon the legal issues, or it depends upon the institution policy, hospital policy. Typically or generally this can range from 5 to 10 years. So usually patient health record may be stored or retained up to 10 years or 5 to 10 years after a patient's last visit or discharge from the particular organization or hospital or healthcare setting or agency, depending on the jurisdiction, depending on the law or legislation. That comes a retention period. So retention period may last 5 to 10 years. So the hospital authority has to retain the particular period of that medical or patient records. So under retention policy, second one is filing or storing of records in the medical record room. That is MR room, medical record room. So how to file or store the record during the retention period? It can be filed or it can be stored as alphabetically or numerically or geographically. Okay, alphabetically, as we can store all the records together in A. So all the alphabet A together and B together like that. Okay, we can arrange, or we can file or we can store the medical records or healthcare records. Numerically, we can store or file as a year wise, that is annually. Okay, that is 2024, 2023, 2022, 25 like that. Okay, that is annually. Then monthly also. In 2004, we can again make a January, February, March like that. Or all the January files, all the February files, like that also we can store under numerically. And last one is geographically, based on the place, based on the location, based on the village, based on the ward, etc. we can store, especially in community setting. We follow the based on the place, based on the location, based on the village, etc. Okay. So in this three way we can file or store the medical or healthcare records in medical record room. Then third point under retention period is secure disposal. After the retention we have to dispose the medical or health record, that should be safely. Okay, that is secure disposal. Once the record exceed their retention period, okay, 5 years or 10 years, they should be disposed of securely as per the policy, as per the norms of the government, as per the norms of the legislation or law, or as per the policies of the institution or hospital. That must ensure no personal data of this medical or health record is compromised, is to be available by any of the person. Okay, so that has to be disposed safely under safe custody, that is called secure disposal. So once the record exceeds their retention period, it has to be disposed safely and securely as per the policy or norms. Then afterward, no personal data of the patient must be available anyone after the disposal. Okay. The last one is 10th one is training and education. Okay, continuous training for healthcare professionals or health personnel or health staff on proper record keeping practices, both medical and health record keeping practices is very important. Okay, and continuous training about the different new laws in related to the maintaining the confidentiality, privacy, okay, of the medical record, and the use of electronic health record, that is electronic system, our health management information system, etc. is the vital or important for the health personnel to maintain the quality and standards of the health records. Thus, to maintain the quality and standards of the healthcare records or medical records, continuous training has to be provided to the healthcare professional or staff of the particular institution. Okay, that is comes under training and education in relation to how to maintain the medical and health record, and what are the principles has to be followed, what are the laws or privacy laws has to be obeyed, and how to use the different electronic system and management health information system, etc. Okay. So far we have discussed the important component involved in the maintenance of records and reports. Okay, there are 10 important components we have discussed. First one is accuracy and completeness. In that it includes accurate data entry in the medical and health record, then and complete entry of the patient data, that is completeness. Then timeliness. Okay, soon after the information collected from the patient has to be recorded, or soon after the procedure it has to be recorded. Delay will lose the data, or we may forget about the information what we have collected from the patient. Then third one is data privacy and security. Data privacy and security includes compliance with HIPAA, HIPAA and data encryption. Then fourth one is maintaining the standardization of a record. That includes uniform documentation practices based on the national and international government norms or laws, and use of available electronic health records. Okay. Fifth one is regular audits and updates. It includes audit and software updates. Then accessibility. Sixth one is accessibility. That is role-based access of the health records and availability of the health records for the health team members. Then seventh one is backup of the data of the medical and healthcare record and disaster recovery planning for the healthcare or medical records. Then eighth one is compliance with the legal and regulatory standards or laws. Okay, follow or abide with the legal practices and regulatory or legislative standards of the medical and healthcare record. Ninth one is retention policies. It includes a retention period, filing and storing of the records in the medical record room, and secure disposal of the records after retention period. And last one is training and education to all the healthcare staff in the institution to maintain the record and reports of the particular institution as per hospital and institution policy. So in short, efficient or effective maintenance of the healthcare records and reports enhance, promote the patient safety. Okay, it gives the legal protection both for the health personnel and institution and for the even for the patient, and it can helps to comprehensive and patient-centered healthcare. Okay, so efficient maintenance of healthcare records and reports enhances patient safety, legal protection, and the overall quality of the care delivered in that particular hospital or healthcare setting or healthcare agency. So thanks for watching. Hope this video really benefits in your studies. If you feel it is really worth and beneficial, please like, share and subscribe my channel, and stay tuned with the Angel Health Academy. Please don't forget to convey your regards in the comment box. And once again, thanks for watching my video. See you and take care.